Welcome to the Learning Lab. My name is Roman Garcia. Today we're going to go over an idea, a concept that we've briefly introduced into our videos and into our lexicon of how it is that we evaluate knee osteoarthritis patients. But I'm going to go a little bit further in depth in this concept. And the reason I want to do this is because I do a lot of teaching in the teaching circuit, and I work with a lot of doctors who are interested in understanding how to better evaluate their knee patients. So I set up a protocol in their centers, and what I find extremely fascinating is how little physicians and other professionals who deal with knee osteoarthritis cases really know how to evaluate in depth their patients. These centers, these physicians, they're basically just going on MRI reports or simple interpretation of X-ray films. And as we've been seeing with all our videos is that a true greater understanding of knee osteoarthritis cases involves insightful biomechanical and biological concepts that need to be amalgamated, put together in order for the physician to truly come up with an intervention plan that's unique to their patients. And that's basically what I do. And I want to introduce a concept that when I introduce to these centers, they look at me as if I'm speaking Chinese, because it's an idea, it's a concept, it's a paradigm that is completely new to them, but I think it's one that's critical in evaluating knee osteoarthritis cases. And the terminology, the label that I coined for this particular concept is something that, if you've been following our videos, is something that you've seen before, which is symmetry breaking. Now, all symmetry breaking is in medicine or in knee osteoarthritis, or really in general health, generally in health, in general health for humans, for people, for patients, is that nature really tries real hard to create symmetry between the right and the left side of the body, especially in the musculoskeletal arena, where having an asymmetrical side relative to the other can create biomechanical havoc, which over a period of time creates degenerative changes anywhere along the weight-bearing structures, especially the knee. Now, symmetry breaking basically is that it's a label. It's a context where you put a patient in whenever they demonstrate on an X-ray film a difference between the right knee and the left knee. Because unless you define this asymmetry breaking, the physician or the practitioner will be confused, will not understand that there are great structural differences existing in their patients, and they will treat both knees as if they were both incurring the same type of degenerative changes. And unless you really identify this symmetry breaking in knee cases, you will not be able to assist that individual who demonstrates asymmetry breaking in their knees. Because when the individual is suffering from these symmetry breaking conditions, they will demonstrate different degenerative changes in different parts of their knee, because the weight load is being incurred or is converging on different sides in each knee. So I'm going to show you a typical classic textbook case of an X-ray of a patient who is demonstrating symmetry breaking. The first thing I'm going to show you is the X-ray itself. This is a case, I believe it was a female who came to us with DJ complains of knee pain on both knees, one more than the other. This right here is the right one. This is the right knee. This is the left knee. Now, when you see the x-rays, just like when you first see the x-ray, it's obvious. You see that the right knee shows more structural damage than the left knee does. This is quite obvious. And this is pretty much where the typical physician who doesn't have insight into this new paradigm that we use to evaluate knee cases, this is where his interpretation will stop. He will just tell his patient, listen, you have arthritis of your knee, you're bone on bone, and you need a knee replacement, and there's nothing that can be done. And that's basically all the information that that physician will give their patient. That patient will leave their center with that little bit of useless information. Now, when you use the protocol that we've been demonstrating, showing on these videos, the insight, the subtleties of this situation and the intervention plan, using our protocols, the physician, the practitioner will be able to create a program unique to the characteristics of this particular X-ray or individual. Now, I'm gonna show you now symmetry breaking and how you come to understand or identify symmetry breaking. Now, this is the X-ray right here. I'll go through it again. This is the right, this is the left. You can see this is the inside, this is the outside. The inside of the knee, this area right over here, very stressed. The left, not so much. There's still some viable cartilage on this knee, but it does show degenerative changes. Now, once we overlay our protocol over the X-ray, which is basically what I teach, the centers, you come out with these figures, with these geometric forms. We've done this before. I'm not going to go through each particular except the one that identifies the symmetry breaking, which is this vertical line right here. Again, this is the right, this is the left. Now, this vertical line tells you whether the knee is in varus or bowing or is in valgus or knocking. Now, the interesting thing is here, if you were just to look at this X-rays the way that the traditional medical centers do, they would just look at it and they will have no opinion as to whether the knee is in bowing, knocking, or what. A more astute physician may realize that the knees look as if they are bowing, and he would be half right. Because once you do these overlays on the X-rays, it's very clear that the right knee is in bowing because this vertical line crosses the outside part of the knee, but the left knee is in knocking. This is symmetry breaking right here. You have one knee that's bowing, the right, and you have one knee that's knocking. The knee that's knocking is the one that's doing all the modification secondary to this degenerative condition, which is very aggressive to the right knee. But the problem that this person is going to experience is that eventually this patient is going to start to develop aggressive degenerative changes in the left knee, typical of a knee that's in knock knee. Now, the problem, the interesting thing is that when the practitioner or the physician understands the concept of symmetry breaking, they can create an intervention which is specific to whether they want to emphasize their effort on the right knee or the left knee. The right knee gets the bow leg intervention. The left knee gets the knock knee intervention. Or he treats both, but with different intervention, with different objectives. But he would only understand this if he can define symmetry breaking. And the only way you can do it is by creating these geometric figures onto the x-rays. And unless the physician does that, the individual is only going to be getting very rudimentary information, which is absolutely 100% useless to that patient. So this is symmetry breaking right over here. When you have one knee that's showing varus and the other one showing valgus, or bowing and knocking. This happens in 50% of the cases where you have symmetry breaking. And it's the reason why we are so successful in treating these conditions conservatively. Because we can identify which area of the knee is under duress, excessive duress, and then implement an intervention which is unique, specific to that particular knee. And the symmetry breaking, because the objective of one of the objectives of our intervention is to reestablish symmetry, where you have a symmetrical condition. You have varus here, or knocking here, or in the best case scenario, where you have neutral on both knees. The weight-bearing load falls medial, so this vertical line right over here will not be traveling toward either the outside, which is what you see in bowing, or inside, is what you see on knocking. Now, I'm going to show you now a case. It's kind of a small picture, but I want Carlos, if you can zoom in on this. Let me do it like this, so you have a black foreground over here. Now, this is a case where the patient came to us. You got the good picture? Mm-hmm. In this case right here, this individual does not demonstrate symmetry breaking, because both knees are in a knocking structural state. You can see the vertical line on the right knee, which is this one, left knee over here. The right knee line, the vertical line crosses the inside part of the tibia. And you can see on the left, it does the same thing. So this knee is not in a symmetry breaking state. This knee is a lot easier to treat than the one I showed you earlier where there was symmetry breaking. Because there's enough, with the original case with the symmetry breaking knee, you have a situation where the weight loads are asymmetrical right to left. And the human body, a bipedal body, that does not have symmetry between the right and the left is a condition that's a lot harder to treat than one that is symmetrical, even though it's in a degenerative state. Because both knees receive the same type of intervention and they tend to respond faster because they are symmetrical. There's no symmetry breaking here. Now, what I want to do now is I'm going to introduce you again to my assistant, Anna.
Hi everybody. Merry Christmas and Happy New Year.
Now, the reason that I want you to, I'm going to show you something with Anna now. We've examined Anna's knees before. We know that she's in knocking. But if Anna were to come to me with knee pains, once I examine her, and I'll let her stand up so you can get an idea. Anna, párate. Y stand like this, perfect, just like that. Now, if you look at Anna's knees, if you look at Anna's knees, it's hard to tell whether she's in knocking or in bowing. This knee, if you've evaluated many knees before, sometimes you can get idea just from looking from the outside whether the individual is knocking or bowing. Obviously, there's these really serious knocking and bowing knees that it's very obvious. But since Anna's knees are structurally healthy, you could not appreciate it from the outside. But just from, I mean, obviously, I've examined Anna's knees many times before, so I know I know very well how these knees are, and I know that both of them are in knocking. So Anna does not demonstrate symmetry breaking. But if you were to look at the knees and try to make an objective opinion, give an objective opinion of whether Anna is knocking or bowing, you wouldn't be able to. Because from just looking at it, it appears that the right knee is in knocking and the left knee is in bowing. But when you look at the x-rays and you perform those geometric, te puedes sentar aquí, Agua. When you look at her x-rays and you place those overlays, those geometric figure overlays over her knees, it's very clear that Anna is knocking on both knees. But this isn't, her knocking is not of the degenerative type. It's more genetically invested in her knees. That's just how her knees are. They are in a knocking state. They're not abnormal. They're normal for her. There is a difference. But the point is that you would not know, and you wouldn't be able to give Anna, if she came to me with knee pains, any kind of advice if you didn't really define whether she was symmetry breaking or not. Because all individuals who come with symmetry breaking have a degenerative condition in their knees already, or else the knees would not be asymmetrical. So this symmetry breaking concept is something that I really try to emphasize whenever I go to a center and I try to teach, or I teach this concept, this idea to the centers. It's a very important concept, and one that's completely foreign to all my students, all the centers that I go to. But it's a very valuable concept to understand and apply. And if you have knee pains and you go to a center, you go to a doctor, you go to an ortho, a chiropractor, anybody, and they're evaluating your knees and they're not giving you specific valgus or varus quality information, then you are not getting a proper physical examination. You're leaving that center with very little advice or information that you're going to be able to use to your benefit. So anybody who watches this video, if you have any questions, if you have any questions, if you have any recommendations, if you have anything to say about what we just discussed today, if you're interested in me visiting your center and teaching you these ideas, feel free to contact me on my web page. I always put a phone number there. I put an email address. You can contact me and we can discuss what I can do for you. So this is the last video of 2018. It's been a great honor trying to teach, because that's basically our idea, is to try to teach not only professionals but also the public. And that's basically our objective. So it's been incredibly fun. Look forward to seeing new videos for 2019. If you have any questions, again, feel free to give us a call. Merry Christmas to everybody. Happy Hanukkah. Have a great New Year, and we'll see you next year.
Bye.
Bye.